I'll try. I'm usually walking around and very animated, so just give me a signal if I start to stray. Thank you very much. So one of the things I'd like to start with is clearly we've all taken the blue pill. Obviously, have we all seen the movie The Matrix? Right? We're all kind of unplugged, and I love that because, in my opinion, we're all our own doctors, right? And we do seek like-minded individuals to raise up, to bring us to a different level for different information. And most of us, I would think, are sick of being, we don't really want to be educated by the commercials on TV, right? Because gosh, those side effects, horrendous, right? So doctor means teacher. And to educate means to draw out the information. And in my opinion, for somebody to just give you information, you should stew on that and take it home and see what works for you. That's a true personal education. And you should seek out those practitioners that resonate the best with you and are congruent with what you want for your health. Does that make sense? Mm-hmm. So with that, we're going to take toxicity to the next level. So again, we're open for some great information. So this is your wellness pyramid right here. At the basis of everything is eat right, okay? You are what you eat, garbage in, garbage out. How many of you remember when the first computers came out, the old MS-DOS, right? But that is really important for anything and every situation in your body. The next is to exercise. You gotta move your body. Whether you break it up 3 sections of 10 minutes a day, or you can do a 30-minute to a 60-minute workout, great. Rest and manage stress. That is not so easy in the technological age. How many of you have a cell phone? Everyone, right? And how many of you turn off your cell phone at 8 o'clock at night? No. Right? For Dr. G, very good. I do one thing. So resting and managing stress, that's kind of where we live. And we try to manage our stress, but we can never truly unplug. I had heard something years ago, probably a couple years ago, that our great-grandparents didn't have the stress in their whole lives that we had in 1 week. Okay? So reducing toxic load, we're going to get into a little bit more of that today, but below this line is lifestyle. This is what we can control. Above this line, you have something going on, you want to check it out, and you can kind of, take your herbs, take your supplements, maybe do a little detox, go to the chiropractor. And then proactive medical care, something comes and you need to have some expert opinion, right? So we're going to be working on toxins today because what toxicity does, it creates inflammation. And when inflammation isn't handled, what happens? It becomes chronic. And the basis of every disease is inflammation. Whether it be hormonal, or whether it be immune, whether it be musculoskeletal, it's all an inflammation base. Would you agree? Yeah. So let's talk about reducing the toxic load. First of all, how about avoiding toxic exposure? Now, our exposure pathways are the lungs, the GI tract, basically what you eat and what you digest, and then whatever goes on your skin. Toxic load, we generally look at pathogens, which are bugs, viruses, parasites, things that are trying to get into our bodies and kind of take over because, hey, it's a great place to live. You don't have to pay rent. There's always food coming in, right? You don't have to do anything. Chemicals, which not only are from, whatever they're spraying in the air, the geoengineering, but also the chemicals in the water, and chemicals that we're putting on our skin, and of course that's in our food. Radiation, which is also in our environment, and the worst radiation is from the sun. And of course we can't forget the genetically modified foods that we're all eating, but that's another lecture. And chemicals in our environment, I love this quote. It says, "We are living in a world today where lemonade is made from artificial flavors and furniture is made from real lemons." Chew on that, okay? So, and I work with a lot of women in my practice. I work with families, but I work with a lot of women, and one of the first things I say is, what are you using toxicity-wise or chemicals in? And they talk about the organic food, and they talk about this, yet they're going to Bed Bath & Beyond, and they're putting these perfumed lotions, and they're putting perfume right over the thyroid, mind you. And the thyroid, we look at somewhere in the 40s, the thyroid breaks down. How many of you know somebody with hypothyroidism? It used to be really rare. So we're looking at all these chemicals that people take in on a daily basis that we don't think about, whether it be the deodorant or the body lotion or cologne, fake tan, whatever it is. So all of these things stress the body. First of all, physical stress. Physical stress is the falling down the stairs, it's having a car accident. It's the stress at work. How many of you are stressed out, you notice your shoulders are in your ears, right? Chemical stress, a lot of the toxins in the environment, pollution in the air, pollution in the water, don't want to forget you guys over here, pollution in the water, but anything that's chemical that's coming, that we're allowing into our homes and into our environment. And of course, emotional stress. Does emotional stress have a physical result?
Absolutely.
Yeah, it does. So what happens is these three stresses put our nervous system into a fight or flight situation. Now, your nervous system has a stress part that keeps us alive, right? It's the sympathetic nervous system and the parasympathetic nervous system, the two sides. The sympathetic nervous system is an old mechanism that kept us safe. When we were out foraging in the woods for organic berries, because then they didn't have pesticides, herbicides, and fungicides. If you saw a lion out of the side of your eye, what do? Holy cow! Where's the exit? Your pupils dilate. The blood goes from your stomach, where you're digesting berries, to your legs. Your breath becomes shallow, and your heart beats really fast so you can get the heck out of there. So you run away, you burn off that energy. And then you say, okay, I'm safe, and your body resumes to normal, right? The blood goes back to your stomach, your digestion continues, your breathing gets deeper. Guess what? We live in a fight or flight world. Let's go back to those cell phones that are constantly ringing. Let's go back to demands of work and life and children and balance. That's constant fight or flight situations that we're living in. Does your body ever really get to come down and rest? No. It gets stuck in autonomic imbalance. What happens then is you have a cycle of muscle tension, spinal misalignment, because what that does, it actually affects your body and the way your nervous system can work. And it creates a subluxation. A subluxation is a misalignment in the spine, which doesn't just happen when you went out and you did gardening for 3 hours, or you had a car accident or fell down the stairs. It happens from chemical stress and emotional stress as well. What happens when you have spinal misalignment or subluxation? Now your immune system is compromised, your hormones are potentially compromised, your digestive system is compromised, and now we start to look at the disease process, and then we go back up to here, and it makes everything worse, right? You ever feel that downward spiral when everything starts to be falling apart, right? So these are the noticeable effects when we're stuck in fight or flight. Pupils dilate, mouth goes dry, shoulder and neck muscles tense, heart beats quickly. Breathing is fast and shallow for oxygen. And you're sweating because you want to cool the body down to be able to go for your run. What are the hidden effects that we don't think about? Your brain gets ready for action. Adrenaline is produced for fight or flight. We're seeing people in adrenal fatigue. Their bodies can't come down. They're not burning it off. They're stuck. Liver releases glucose to provide energy for muscles. Liver does a lot of stuff, and now it's constantly providing glucose to burn for energy, and that energy is not being burned. So, I mean, that's a whole other, that's like a 2-hour class, right? And then the blood pressure rises. Do any of you know anyone with high blood pressure? You think they might be stuck in this place, right? Or digestive issues, or, let's go into, we could talk about a whole host of other things. So, with that, what happens is, from a physiological standpoint, we're going to shift over. This is a side view of your brain, okay? The logical, the outside part of the brain is the community, it's the deep thought, it's the problem solving. What happens when we're in fight or flight, in a stress situation, it shifts us back into the reptilian survival mode, okay? Now, when we are in that mode, it's all about, what I can do for myself. I have to it's survival mode. And how many of you feel sometimes you're just trying to survive, you're just trying to get through the day, and you don't feel good, and you're trying this stuff and you're not feeling any better, and you're getting frustrated, right? It becomes a cycle. So what our goal is with the adjustment, it's not just cracking backs. It's not just, taking somebody's back or neck pain away. Most of the patients that come to me are not coming for back or neck pain. They're coming to have their bodies work better, especially in this situation where we are trying to shift from the reptilian brain to the logical brain. Now, when you think of the reptilian brain, we think of like a toddler, a 2-year-old. They have the tantrums, right? They have the temporal tantrums, where they just want it now, they want the toy, they drop on the floor. How many of you feel like that sometimes? I know I do, right? But it's not acceptable for us to do anything about it as adults. So shifting back into this mode, can you start to see now how some of these things, the physical stress, the chemical stress, and the emotional stress affect your bodies, right? And you kind of feel stuck. Okay, so supporting defensive functions. The biggest defensive function you can support is getting your body to work properly. So this picture on the left here is a normal side view of a spine. And we have this yellow guy coming out of there that actually kind of looks like a banana blown up like this. And here we have a subluxated vertebra. We have a misalignment. And that red nerve right there, each nerve has different components to it. It doesn't just go to your back, low back and say, okay, I have back pain. There's also a lymphatic component to it. There's a sensory component. So if you reach out and you touch a stove and it's hot, your brain's going to tell you to pull your hand away, right? Logical. You don't want to burn yourself. But it also is responsible for a lot of things that we don't think about. For example, if you take a bite of food, if your brain tastes sugar, because you don't taste with your tongue, you taste with your brain. Your brain sends a message to the pancreas to release insulin because sugar's coming down. What if the nerve going to the pancreas was misaligned and it wasn't going to get the message, or it was distorted? Would that affect the digestion? Absolutely. And from a subluxation standpoint, only 18% of the nerve fibers are responsible for pain. 82% of those do something else. So if you do in fact have an issue somewhere, you could come in for a neck problem and actually have something going on in your low back that's impeding your menstrual cycle, your digestion, or something else. Does that make sense? So this diagram is further indicating at each level of the spine, we have nerves that go to these different organs. And for example, if I have somebody that comes in with neck pain and says, I'm chronically constipated, other than looking at their diet, we're going to look and see if something's going on in the low back, because the nerves in the low back, if those nerves going to the intestines are not communicating with the brain properly, that is going to impede the bowels from moving properly. Or in the mid-back. My journey into chiropractic happened, I studied international business, and I was working in a vitamin company, and I was rear-ended, and I had a car accident when I was 24. And the orthopedist wanted to operate. In those days, they cut your neck from top to the bottom. They didn't have laser surgery, right? So I declined, and I continued to go to the chiropractor, and what I noticed was my asthma improved. I did a lot of sports, and I still do. My recovery time improved, and my performance improved, and I wasn't having headaches anymore. And that had nothing to do, I wasn't being treated for that. So that kind of started the journey, right? And that's when I realized the significance of how the body works and true health, okay? So this is a picture of one of my patients, a young man, 16 years old. If you look on the left, that's how he walked in. He has ADD, ADHD, and if you can't see over there, this is his posture, okay? And the side view didn't upload for some reason, but basically he was like this, okay? And very poor focusing abilities, and his parents were pretty frustrated. After one adjustment, this is how he walked out. Can you see the difference? Right? Now let's do a little how am I doing on time? Good. So everybody lean forward in your seat and kind of stick your head and take a big deep breath and exhale. And turn your head and look to the right, that way, and to the left. Okay, now sit up nice and straight. And now take a big deep breath. Got a lot more air that time, didn't you? So posture matters, right? It's not just looking good and looking taller, and some people say look a little thinner, right? But posture matters. Your body works better, okay? Your brain functions better. And one of my highest recommendations for the people nowadays, it used to be just kids, but watch the devices. The devices, they're designed to keep your brain turned on, right? Keep you in sympathetic mode. they're very much like the gambling machines and the jackpot machines, where every time you get a text message or an email, a little dopamine goes off in your brain, and it keeps you amped. Turn them off, okay? Give yourself a break at night. So supporting eliminated functions, the primary chimney is the intestinal tract and the urinary system. We want to make sure they're moving. The secondary chimney is the respiratory system and the skin. We want to make sure if somebody has acne, eczema, psoriasis, we want to make sure we get the primary chimneys going, because whatever doesn't go through here comes out of the skin. Okay? The quality of healing is directly proportional to the functional capacity of the central nervous system to send and receive nerve messages. If your body is not communicating properly with the brain, then you can cleanse, you can take vitamins, you can take herbs, you can do whatever you want to do. It's not going to work properly. It'll help, trust me. But you change your diet, you change your life. However, if your body's not working properly, a lot of the methods that you're going to do aren't going to be working as well as they could. Okay? Water, we want to make sure we drink enough water, half of your body weight in ounces. Most people are severely dehydrated. Eat for health. It's not an extreme, it's essential. And healthcare starts in your kitchen. I believe healthcare starts in your home and in your community in all aspects. Teach your children, be an example. You don't have to do what everybody else is doing, because everybody else is, are they going to get sick? We don't want you to get sick. So make different choices and make better choices for yourself. The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease, said by Thomas Jefferson. I invite each of you to become your own best doctor and find the healthcare practitioners. I totally agree that we are not the alternative. We are, I guess, the original, but we should be the primary, right? The alternative is nothing else works. Okay, maybe you need some medication, right? So I invite each of you to do that. And thank you for being here today. I hope you got a lot of information out of it.